Hello everyone. We are going to continue with the chapter Human Health and Diseases part 19. And in the previous video we have learnt about immune system, innate immunity, acquired immunity and the structure of antibody. And today's topic we are going to move on to AIDS. So what is AIDS? So AIDS is acquired immunodeficiency syndrome. Acquired immunodeficiency syndrome. And this disorder, it is caused by an organism, it is a virus. It is called as human immunodeficiency virus, okay, HIV. And this HIV, it belongs to a group of viruses called as retroviruses. And it comes to know about the fact that these retroviruses, normally they have an enzyme called as reverse transcriptase. So what is the function of this reverse transcriptase is, it converts the viral RNA into single-stranded DNA, right? So we have learned in the previous chapters about reverse flow of transcription, right? Feminism, where the RNA is converted into DNA. So you call that as reverse transcription, right? Okay. And the first AIDS case was reported from California in 1981. This year is very important. And this HIV was first isolated by Montagnier et al. Group of people, 1983, of the Pasteur Institute of Paris. And this AIDS, it is an acquired disease. Normally when you talk about the immunodeficiency diseases, there are two types. One is congenital, which is seen right from the birth, whereas the other one is acquired, after birth, right? So this AIDS is kind of an acquired disease. It is acquired during the lifetime of an individual, indicating that it is not a congenital disease, so which is acquired after the birth. Next is structure of HIV. This HIV is developed within a membrane which is made up of several glycoproteins. So GP here stands for glycoproteins, and there are two types of glycoproteins what is present in HIV. One is glycoprotein 120, the other one is glycoprotein 41. And the central part is called as core. Okay, so here the central part called core of the HIV, it contains two single strands of RNA. Okay, two strands, both are single stranded RNAs, and reverse transcriptase enzyme. And this HIV, it belongs to a member of group called as what? Retrovirus. And this, it has an envelope actually, right, which encloses the RNA genome. So the genetic material will be present inside. It will be enclosed by a membrane called as envelope. So this HIV, it is also called as enveloped virus. So if envelope is present, it is called as enveloped virus, and if the envelope is absent, it is called as non-enveloped viruses. Next is transmission of HIV. How is this human immunodeficiency virus is being transmitted from an infected person to the normal person, right? So first one is it is transmitted through sexual contact with the infected person. So it is the most common method where this HIV is being transmitted through sexual contact. Mostly 65% of this infection takes place only through this sexual method, where it is being transmitted from the affected partner to an unaffected partner. Okay. And next is by transfusion of contaminated blood and blood products. So when you talk about this contaminated blood, it may be through contaminated razor or syringe, or the other products what do they use for this surgeries, right? If it is not being sterilized, so even unsterilized needles. So all these products are being transmitted. So through this blood products also, HIV can be transmitted from an infected person to the normal person. And next one is sharing infected needles, right? This is what I told you just now. Sharing infected needles as in the case of intravenous drug abusers. And next is from infected mother to her child through placenta. So if the female is pregnant, if the mother is pregnant, right? In that case, it is being transmitted to the child through the placenta. Then HIV does not transmit through. So what are the methodologies where it cannot be transmitted? So it does not transmit through mosquito bites, right? It is not a vector-borne disease. Okay, so it does not transmit through mosquito bite, or it does not transmit through shaking hands with AIDS patient, or it does not transmit through sharing either meals or towels or toilets of AIDS patients, and it does not transmit also through hugging or dry kissing with the patients. Okay, next we are going to move on to early symptoms of HIV. So what are the symptoms of HIV? First one, when you just look at this, fever and chills, then sore throat, swollen lymph nodes and mouth ulcers. And next one is muscle fatigue and aches. And here if you see nausea, vomiting and loss of appetite, and then joint pain,
And here headaches and mood swings will be there. Then even pneumonia, cough with phlegm, shortness of breath and chest pain, and then high heart rate and low blood pressure, right? Then clamminess, rashes and blueness of the skin. And just when you just look at the women, changes in menstruation, then even lower belly pain and vaginal yeast infection will also be there. So these are the early symptoms of HIV. So when you just look at this, how does this retrovirus replicate? How does this infection take place in the host cell, right? So when you just look at this replication, you can see this retrovirus. What did we learn about retrovirus? So this HIV, it belongs to a group of viruses called as retrovirus, right? Which has a viral protein code and the viral RNA code. And when this virus infects the normal cell, what happens? Normally the host cell, right? So this viral RNA is introduced into the cell, but with the help of the enzyme called as reverse transcriptase. We have learned that reverse transcriptase enzyme is present in the HIV virus, right? So what is the function of this reverse transcriptase? It converts the RNA into DNA. That is what you have to just remember here. So the viral RNA is being converted into viral DNA, where we use the term reverse transcription. So this is done only by the presence of the enzyme called as reverse transcriptase, right? So what happens once the viral DNA is produced? It incorporates into host genome. And then what will happen here? It multiplies along with the host material, genetic material. And after that, when you see new viral RNA is produced by the infected cell. And new viruses are also produced. So when you look at here, new viruses can infect other cells. So now these viruses will have the same material what is present here. So this is how replication of retrovirus takes place inside the host.
Next is diagnosis of HIV. There are several methods used to diagnose HIV. One such method, the preliminary method, what is used here, you call this as ELISA. ELISA, enzyme linked immunosorbent assay. So this is the preliminary method what is used to diagnose HIV. And next one is confirmatory method. Here you call this as Western blot test. And even PCR test is also used, polymerase chain reaction. And next is about prevention of AIDS. So here the barrier must be used, right? So the barrier should be used during sexual act with the suspected partner, and restriction to one sexual partner, and use of sterilized needles and syringes like razors or forceps or whatever is used during surgeries. So it has to be sterilized. And before donating blood, HIV test should be done, and education about AIDS should be given to the people. And next is treatment of AIDS. And here some drugs are being used to treat AIDS. And when you just look at these drugs, it does not cure AIDS, right? It just prolongs the life of the patient, that's it. And it is not completely curable. Okay, one such drug what is being commonly used to treat AIDS is azithromycin, AZT. And other drugs include such as tavudine, dideoxycytidine, dideoxyenosin. Okay, and all these drugs block the conversion of retroviral RNA to gene as they are nucleotide analogs. If you like this video, share, comment and subscribe my YouTube channel and follow me on Facebook and Instagram. Thank you.